is bringing up not only children with a good life, but those who are thriving in their lives so that they reach their potential and be productive in adulthood. Thank you.
Great. Reaching potential and be productive. Next. The microphone is going around the room. Leo tunasikia sauti ya kila mtu.
To me, immunization means only one thing, survival.
One thing, survival. Meaning that maybe you've seen of cases of people not surviving. So, chanjo ikikuja, kuna survival. Yes.
To me, immunization means saving lives with vaccine-preventable vaccine.
Saving lives.
To me, it means introduction of the antigens to protect against these diseases.
Again, msomi mwingine, introduction of antigens to prevent against diseases. Yes.
To me, vaccination is done to maybe enhance the immunity of a kid, but not necessarily a kid anyway, because there are also vaccines for adults, like the COVID one, which was there recently. So maybe for different cadres of ages, we may have different kinds of vaccines.
Thank you so much. Next.
Yeah, for myself, on a layman's language,
exactly,
I understand it as this is an injection that is done for anticipated diseases, to protect the anticipated.
Conversations of anticipation. So we are preventing the diseases that might occur. Yes, next.
Yeah, I'm not a medical doctor, but I will put it in a layman's language. It's just building resistance at an early age by introducing an antigen to ensure that we secure lives.
Another introduction of an antigen. Yes.
Vaccine, for me, immunization means that we are preventing children from getting infectious diseases.
Thank you. Again, prevention. We've had antigens, we've had survival, we had productivity. Where is the mic? Thank you.
Thank you. For me, it means providing prior protection against imminent danger.
You have used security language. Imminent danger. Yes.
For me, it means to prevent these children for getting any infection diseases.
Again, the language of prevention and a language of diseases. Next, it's an open conversation. What does immunization mean to you? No right or wrong answers. Everyone is saying something.
To me, immunization is prevention of mortality, child mortality.
Issues of mortality. Msomi mwingine. So we want to have more children surviving. Yes, kiongozi.
It means be able to prevent or to be able to give some drugs which can prevent infection to occur.
There's another conversation of prevention.
Hello.
Hello.
As everybody has a disclaimer, I'm also not a medic. In fact, the only thing when you talk of immunization, I see the scars on my body. You know, it shows that I was immunized, and of course, I appreciate my parents for making that conscious decision, considering the age group where I belong. Quite a number of people were affected by polio and other preventable diseases. So I appreciate. Thank you.
Thank you. So the Kenya mark. Now there's the introduction of alama. Ukienda Tanzania ulizwa alama, tumemwona huyo ni Mkenya. Alama ya Mkenya.
Asante. Kwangu chanjo ni kudungwa ili kuzuia magonjwa siku za usoni
Aha.
kwa binadamu yeyote yule. Na zaidi ya hayo, hiyo alama.
The conversation around prevention, but also another interesting conversation, because that is what immunization means to the person, is that mark. Next.
Good morning. I'll not say much. I'll just say 2 words. Immunization is about prevention and protection of everyone, not just children. And consequently, it means we have a healthier population that will help the country to be economically productive. Thank you.
Now we are linking immunization to productivity and economic growth. So this is a very interesting angle around immunization. Who thinks of immunization in line of trade and production and economic growth? Next.
Immunization is a process from infectious diseases.
Thank you. Boosting the body's immunity, yes.
Kuzuia ni bora kuliko kuponya.
Hey, prevention is better than cure. Okay, I request that we skip that front row. So I have another question. And we've agreed that there are no right and wrong questions and answers. This year, Kenya introduced a new vaccine. Which vaccine was that? This year. Mike iko kona gani? Mkono ilikuwa juu? Aha.
Okay, this year Kenya has
around issues around sustainability, issues around security. And so really, it's good that we are in this room and we understand immunization. Welcome, Mheshimiwa. So the last question before now we move into starting officially. What was the National Vaccine and Immunization Program started in the Republic of Kenya? Hey, wewe uko na leakage. No, ulikuwa unatengeneza maswali. You're ready to answer. Sawa jibu.
Not really, I'm just wanted to try.
Yes, please.
Okay, Kenya has introduced vaccines for our newborn or children under 5, but now they have introduced up to 14 years for the new vaccine, which is called typhoid. And of late, we have done a campaign for measles and typhoid to our children. Okay.
CHP? Community. Sawa. You've
Okay, I'm a
answered.
nurse professional working in Homa Bay Teaching and Referral Hospital. I'm ambassador for the immunization for our newborn. And I'm ambassador for family planning, 0 to 48 hours. For our women, we are controlling maternal mortality to mothers and male involvement in family planning.
Hiyo ndio inaitwa advocacy. You seize the moment. So back to the question. We said there are no right and wrong answers. You got right that we had a campaign this year for measles, rubella, and typhoid that you've answered well. But question was, which year did the national vaccine and immunization program start in Kenya? Mike Itembe. Sasa zimeanza kuwa ngumu. Turudi tena zile open-ended. Yes.
I can try.
Yes.
In 1980.
Wewe uko na Mwakenya. Wacha niangalie nguo vile imebrandiwa. It's true. So the year 1980, Kenya started the National Vaccine and Immunization Program, which is really a great milestone. But interesting enough, how many years are those? 4, 5. So you can imagine, the vaccine conversation in Kenya has been there for 45 years. And maybe that's why, routinely, mama akitaka excuse ya kutoka kwa boma anasemaga akuwa na mtoto mdogo anaenda wapi? Leo ni siku ya clinic, hakuna vile utanyimwa kutoka, si ndio? So the excuse is, and that shows that for 45 years we've had many lessons that we've learned. We've also had many challenges we've overcome, but most importantly, we've also had many success stories. So, allow me now to transit to the official program. I'm happy that we've interacted. Shida ilikuwa tu sijawauliza majina na mjaniuliza jina langu. I don't know how we started this conversation as Africans without knowing each other. Si tunaanzaga na kujua mtu ametoka wapi, kama kumenyesha, kama tumevuna, majina, tulianza tu. But that is good. Allow me to invite, is Alan in the room? In the interest of time, I can see we have our panelists here, and we truly appreciate, again, in the interest of time, we appreciate that the great county of Homa Bay gave us dinner and a wonderful session yesterday, and so people are trickling in, and we appreciate that. So allow me to invite Alan, who's going to lead us in the opening prayer, and after that, we are going to start the program for the day.
Okay, thank you. Honorable members present, the Governor, Baringo County, Honorable Dr. Bishop, Jackson Kipkemoi, and all other leaders, good morning. It's an honor that we gave you the invite and you honored us to come. I feel very much honored as an immunization lead at the Health NGOs Network. It gives me courage and confidence that we have partners who are willing to support us. So let's believe for a word of prayer. Father, Lord Jesus, we thank you this morning. We thank you that you found us faithful to be here this day. Jehovah God, even as we speak about the immunization of our children, when we look at the future of our children, the future of this nation, we pray that you are going to guide us all through, give us knowledge, give us wisdom, give us understanding, that the deliberations that come from here, Jehovah God, inform the next financing for immunization in this country as we protect our children from vaccine-preventable diseases. In Jesus' name, I do pray and believe. Amen. Thank you.
Okay, thank you so much, Alan. Now we can start officially, and I truly appreciate each and every one of us having come here this early to join the HENNET fraternity in the conversation around securing the future financing immunization for resilient health systems. And as we are going to be reflecting on this and just looking at how children are innocent, but children have put their lives in our hands. Decisions we make determine their future. And so today we are going to be having that conversation and asking ourselves, this child who's in that photograph, have we secured her future to be the leader of tomorrow? Because yes, now she's a young child, but she's looking forward to be an adult. And she's in the hands of an adult today for her to get to that level. So what decisions do we make to secure the future? But even as we are looking at securing the future, it's important for us to also narrow down to immunization as a critical player in securing that future. And as rightfully was mentioned in this room, that Kenya for more than 45 years has focused on immunization through a structured program through the National Vaccine and Immunization Program. And there's been a lot of intervention. Kenya is also part of the countries which played a critical role in the smallpox elimination. And so that's something that we can applaud the country. Let's put our hands together for Kenya. And maybe that's why some people have a mark on their upper arm. They are champions because that was the last lot that had that vaccine, and we had the elimination. And we are looking forward to elimination of more diseases. So really, it's an exciting period to be here. But even as we say all this, we know that immunization is said to be the most cost-effective public health intervention. Most cost-effective, meaning that utampa mtoto chanjo leo, you will secure their future. But even as we're looking at this cost-effective intervention, we are at a time that, as a country, we are celebrating and saying that Kenya is a middle-income country, and that economic placement of the country also places us as a critical conversation that we need to have and ask ourselves, as a middle-income country, who is financing our immunization? The last pointer that you're going to have before we invite the panelists is a very important conversation around the financing of immunization in this country. The Gavi Vaccine Alliance finances immunization in Kenya, and through the beautiful relationship that Gavi has had with Kenya, there is a transition roadmap and there's a transition conversation for Gavi to move from Kenya by the year 2029. As we are all excited looking at Vision 2030, I'm sure in the next few years we are going to be asking ourselves, where are we in the Vision 2030? We are going to be asking ourselves globally, where are we with the Sustainable Development Goals? Again, another critical pillar around 2030. Importantly then, Gavi transition is 2029, just a year before. Are we prepared for that transition? Or are we going to find ourselves in the situation we found ourselves early this year when the US government gave their stop work order? We are happy that Gavi has given us time to prepare. But the question is, are we really prepared? The other question that we are going to be reflecting around is critical conversations around misinformation, disinformation, and a lot of space in the different avenues, especially social media. We've seen so many clips around vaccines. Some correct, some bingo. Please, let's put our hands together. Bwana Governor, there's a ramp on that side and there's a staircase on this side. Let's continue. Let's put our hands together. Welcome, Bwana Governor. Let's put our hands together for Dr. Sunday Ogola, the Director, Medical Services, Kisumu County. Jirani tu hapa. Let us put our hands together for Honorable Dr. Jackson Kipkemoi. Karibu sana Mheshimiwa. Let's put our hands together for Mheshimiwa. Until he comes. 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 Yeah, we are not stopping. The rhythm goes on. And the rhythm goes on. We're in Africa, the rhythm has to go on. Karibu sana. Let's put our hands together for Madam Sarah Atieno. a community champion, a young mother, a trader, and a great champion from the great county of Kisumu. Karibu sana. Last but not least, let's put our hands together for the host for the day, Dr. Margaret Lubale. Dr. Margaret Lubale is the Executive Director of the Health NGOs Network in the country, Karibu sana, until she comes. Until she comes. Until she comes. Oh yeah, until she's here. Welcome so much, Dr. Margaret Lubale. So we have a wonderful panel. And before we start the conversation, we started by breaking the ice and having a lot of conversations. And now allow me to invite Mheshimiwa Dr. Jackson, who's going to start this session for us, with just giving us a lived experience, but also setting the pace around the cost of inaction. Karibu sana, you can give your story.
Thank you. Thank you so much. Our moderator for this session. Yes, it is true, because we don't, in the interest of time, let me focus on to only three things. Number one, we wish to appreciate donors through the efforts of Gavi for many years, having supported the program of immunization in our country, and indeed many other countries. Unfortunately, I was born within the bracket of time between actually I belong to the boomer, what do you call it? Baby boomers of the 1945 and 65. I was born within that time, within that period. And we never were exposed to immunization. I wish it had taken place then. I would have survived the attack of polio. So at the age of 5, I suffered polio, and many of us at that time, 5 years and below, suffered polio all over the world. It is in the record of WHO. So much efforts has been done in this country after independence, and maturing in the 80s, that immunization program, through efforts of many actors in the field, has really a failed immunization product from the medical world. And that has made survival rates for our people. So number one, we need to treat the issue of immunization as a component within the framework of self-preservation as a people and as human beings. It is necessary. It is of priority. And it must be a priority for every program in every government level, especially in our own country, where we have the national and county level. Health facility in immunization must be guided by our concern to survive as a people. The second thing is the issue of sustainability. Now, we have been helped by non-governmental organization, and thanks to the European Union, who have really participated, and through other forums. And interestingly, is that Kenya as a country has been meeting about, is it 25% of the total? And then we were getting about 70% from donors for that period. First of all, we begin from there, just before we discuss even the issue of the deadline, where we have announced about 4 years now to come. And we are thankful for the warning. But first of all, we have been having support from outside, and a bigger portion of it had been really from foreign support. I think, and then it is a report indicates that even the one we were responsible as a country, sometimes it was delayed, we could not pay in time, and yet that is what determined the participation of the international actors. So I think from a legislator's point of view, I wish to appeal to the ministry concerned that as we implement the universal health care in this country, let the issue of immunization becomes more loud so that it attracts the attention of legislators in this country to inform budget making in our nation. We have come of age. I think we have a huge budget dedicated to the Ministry of Health. It won't be any serious issue if this immunization program becomes one of them, that we elevate into a national concern and make it the priority in our budget. So that is one issue I would mention. And in my experience, because I'm speaking as a victim of non-immunized generation at our time, but I remember my mother was sort of, they established friendship with one of the Mamsap, that's the wife of one of the generals in the British post-independent colonial farmers in around Nakuru, and she's the one who insisted that we are seeing your son is a victim of a disease that can be managed. And I was taken to hospital at a very early age by that early days of my, and I think that is why what was salvaged has remained to give me ability that I enjoy today. So I feel for our children. So the final thing I wish to comment on is that whereas we have enjoyed 45 years of immunization programs on our children, there are areas in this country that have not been reached, and especially the mobile families in amongst the nomadic societies. We talk about people who are living in shanties and in very soft cities, but they are, I think, non-governmental organizations have done a good job, and they have really reached out to them. But due to the way and their way of living, these communities has been difficult to be managed, and especially as it relates to their children. And I think with devolution, for example, bringing government closer to the people, this has really worked out magic. We may not realize by now, but I think in few years to come, we will see what devolution has done in this country, bringing government closer to our people. But what we need to do, I think we need to bring up a more robust sensitization through government programs, coordinated by the national government, the Ministry of Health, and then bring up legislative requirements proposal to Parliament, both houses and county assembly, so that we can anchor all the programs affecting this particular project on our children, make it achievable, make it loud in our own programs, and make it a priority in our budgeting. I think those are comments I can make.
Thank you so much. Oh, great. Am I on?
Maybe as you struggle with the mic, I wanted to add the final thing, and that is on research. I think research must play a big role. Some of these diseases are mutating. Some of these diseases are developing resistance to the drugs already available. So we would like funding not only be done to the programs of immunization, but also on research, collaboration with international researchers, and make sure that the drugs we are availing and vaccines available to our children are relevant and they are able to manage the emerging challenges on several areas. Thank you.
Thank you. For that, allow me, I think I'll borrow your... Okay, thank you so much. Now, proceeding on, picking from the point on prioritization, Your Excellency Governor, how is Baringo County using its health budget to facilitate teen immunization programs, especially now that we're already even talking about donors reducing their financing, but also Gavi reducing its financing and talking about transition?
Thank you very much. Let me first take this opportunity to appreciate the organizers of this side event on the future financing immunization for resilient health systems. This is because it is an important subject. Health, according to the Kenya Constitution, is a right. Is a basic right. So access to health and all things associated with health is fundamental. And that is why the government of Kenya has given itself a target of universal health care, with all the strategies of raising funding to be able to finance health care. To me also, health should be seen as a security issue. And immunization fundamentally is very important, because if you don't treat immunization as a security issue, like we deal with food security, then the future nation will have a challenge, both economically and financially. For us in Baringo County, I want to say that the level of immunization is reasonable. We have at least not less than 85% of our young children being vaccinated. And of course, as you're aware, historically, the financing of immunization has been driven by donors. Gavi, as has been said by my brother and MP from Baringo County, Honorable Koske, Gavi has shouldered the largest proportion of immunization. And the fact that we are exiting in 2029 should raise a red flag for us. As a county, you are aware that this health is a fully devolved function, meaning, therefore, counties must prepare themselves to take on that responsibility of immunization fully by 2029. As at the moment, as a county, we still rely heavily on Gavi. And we are now organizing ourselves to start looking at using our own resources for financing immunization. I can split the costs of immunization to two. The tools that are required for the immunization, the transport costs, the syringes and those kind of things, the transportation costs, or what can I call it? The tools are non-pharmaceuticals, and then the transportation of the same vaccines to the places that vaccination must happen, and of course the procurement of the vaccines. In Baringo County, we estimate that we require about 100 million shillings, 109 million shillings annually for immunization. So it means since the government and Gavi have been shouldering that responsibility, we as a county must now start planning out of our own resources, the resources that we use to purchase drugs, the resources that we use to purchase non-pharmaceuticals, and the financing of the transportation of the same. Luckily, we have outreach programs for reaching out to hard-to-reach areas. Baringo County is a very vast county, 11,000 square kilometers. Some of these places are so distant that you have to have specific interventions to ensure that vaccines reach the consumers. We have done very well in improving access to health, dispensaries being available in even the most remotest areas. Sometimes there's a challenge of electricity and challenge of storage of vaccines. So we are looking at ensuring that every facility has got one form of power or the other, and to be able to support the preservation of vaccines through having fridges and so on and so forth. So yes, I can say the county has been providing counterpart funding under the ongoing Danida program for primary health care facilities, which provide immunization services. The amount spent per year is 8.9 million. So if you look at 8.9 million and you compare it to the 109 million that is required, then that is a drop in the ocean. The county budget also supports the cold chain infrastructure, including fridges and associated maintenance costs, logistics and vaccine transport, especially to remote areas. We have got 2 vans that go around the county. One is donated by the Mama Doing Good program, and the other one is the Beyond Zero campaign that we equip it with all the required things to be able to facilitate the vaccination. We do support the human resource, all the nurses, the CHPs, the lab technicians that are administering these vaccines are employees of Baringo County government. We also do capacity building of staff on immunization using the TOT approach and funding to community units to the tune of 2.715 million to support referrals and defaulter tracing by CHPs. What are the challenges? Still, we have a challenge of vaccine stockouts. I think not too long ago, there was an issue saying that there are issues of vaccines not being available. I mean, these vaccines are not manufactured here in Kenya or in Baringo County. So the challenge that we need to think about as a country is, for how long are we going to depend on importation of vaccines? Start thinking about supporting our local researchers to develop vaccines locally that can be manufactured locally. We have done it in the veterinary sector. All vaccines, most of the vaccines that are given to our animals, cows and goats and sheep and chicken, is manufactured locally. Why do we not think about manufacturing human vaccines locally so that we can avoid the issue of stockouts? Again, we can also be able to manage the costs. Importation of vaccines is expensive because of travel distance and so on and so forth. And even the security of the vaccines. Sometimes when you want to do a vaccine here, they say, oh, it's Bill Gates, he's the one they're trying to create a situation where people are going to be, I don't know what to use, which word to use, that you want to exterminate the African race to depopulate, that these Africans have become very strong. There are too many in Europe and everywhere, and we want to depopulate Africans. There are also challenges in our county. Sometimes we have some elements of insecurity that makes it difficult for vaccine access by our citizens. And more important is limited fiscal space due to competing priorities. Yes, what do we want to do? What is the most important element of our budget? What do we think we should do? Let us think about performance-based financing and ring-fencing immunization budgets to promote sustainability following phase out of Gavi. We must ring-fence immunization as a function. So we must ring-fence financing for immunization. Why don't we think about setting aside the 100 million shillings annually for managing this immunization process? Or we borrow a leaf from KEMSA regarding the transportation of vaccines to the last mile. Or we can partner with KEMSA so that if the vaccines are available in centralized in Nairobi, why don't you partner with KEMSA in the distribution of vaccines? They are very effective. They take medicine to the farthest and the remotest area in the county. And then, of course, we need to ensure electricity supply to all health facilities. And we need to consider cost-effective, renewable forms of energy. In our county, the penetration of electricity is limited. And because it's limited, you go to a dispensary, you find that there is no electricity. So what do? We have to consider solarization. And even as we speak now, we as a county are planning to solarize all health facilities so that it is possible to be able to store vaccines properly. Thank you.
Thank you. Okay, thank you so much. And you've brought in very important points around looking at reaching the last mile. How do we borrow from the KEMSA approach? Looking at ring-fencing, immunization financing, local manufacturing, but at the same time also reaching people who are in far-to-reach areas. So moving the conversation, Dr. Ogola, you are the Director of Medical Services, Kisumu County, and this is also around the county approach. What innovative strategies can counties employ to improve immunization coverage? And you can cite the success story of Muhoroni in terms of immunization. I think we'll pass on my mic.
Thank you. Can you hear me? Thank you so much, our moderator, for this session. And allow me ride on the already set protocols. I want to state categorically for the innovative or strategies Kisumu County has used to improve on its coverage for vaccines. And here I'm wearing two hats. Number one, as a Director of Medical Services in the county government of Kisumu, and number two, as an advocate for vaccines. From my training as a pediatrician and child health specialist, I know and understand what it means when you talk about vaccination. So number one, Kisumu County, we use one strategy, some of the strategy, and number one was community engagement and demand creation. How did we do this? The community engagement, we first sensitize our CHPs, the level 1, to map out all house to house, mapping all these households on what we call the dose and those who are defaulters, so that we use what we call a targeted outreach for those areas. During that period, there is one of the serious barriers to vaccination, and this is what we call vaccine hesitancy. During this period, we employed what we call the use of those trusted messengers. Who are the trusted messengers? In the community, one of those people are the religious leaders. They are trusted with their members. The community leaders, the opinion leaders, we brought them on board so that we reduce and we counteract the vaccine hesitancy. This really helped Muhoroni sub-county, which is a little bit vast when you compare it with other sub-counties in Kisumu. It helped us to move our vaccination from a percentage of 76 to 86%. This is one of those most effective strategies. Number two, we use a strategy which we call the big catch-up. The big catch-up was introduced globally in 2023, and Kisumu, we ran with it. Big catch-up is where the targeted immunization outreaches are done weekly. You use the data after mapping out, and you go out creating the demands weekly. And we did that, and that improved. So we ran with big catch-up. Number 3, we are leveraging on technology. You realize that Kisumu gave a platform to Zipline. And we have leveraged on Zipline by use of drone to reach those hard-reach areas. There is vaccination, which we call rabies vaccination. When somebody is bitten with a snake, you need to give anti-rabies vaccine. No facility can you stock all your facilities in the country or in the county with anti-rabies, because how many snake bites will you receive in a year in that particular facility? It means that your vaccine will go bad or will expire on you. So what we leverage on is those specific anti-Ds, vaccines like anti-rabies, anti-venom. We put them on the Zipline so that whenever there is a case, they reach their target places in not more than 15 minutes. We have also leveraged on what we call HPV+. Number 4. We have leveraged this with the use or with the partnership from UNICEF. HPV+ is a state whereby when children of that age, 10 to 14, receive other services in health, sexual reproductive health, HIV services, not immunization, but nutrition, we embed the HPV vaccine in these services. Whenever we have those activities, we educate them and we vaccinate them on that. The last one also, that strategy that we use as Kisumu to improve, is called use of art as advocacy for HPV. How did we do this? We use art in primary schools. Give them choral verses, give them plays, give them dramas, let them compete. And the message was HPV vaccination. And I can tell you, a school in Kisumu City called Aria, primary school Aria. Aria was #1 in Kenya. And we had a time to go with the principal or the head teacher to Nairobi, receive some recognition on that. We used that to pass that message to teachers, to children and girls of 10 to 14 years, and use that platform to vaccinate. So those 5 strategies have really improved vaccine coverage in Kisumu County. Thank you.
Thank you so much for opening our eyes to innovation, community engagement, engaging opinion leaders, religious leaders, technology, which is at times left out, bringing the target young people. Rarely do people talk about the children engagement in decision making, and the fact that you're using art to simplify health messages, but also to increase coverage. Interesting also, you are using the integrated approach for the HPV vaccine, and the integrated approach is the next question that we'd like to channel to Dr. Margaret Lubale. What are the opportunities for civil society to support integrated disease programming for strengthening both immunization and also primary healthcare delivery?
Thank you very much. I think one of the most important things is what Doc has just talked about, the integration of HPV into other services. I think one of the things that we are realizing now as CSOs is that in the tight fiscal space and in the reality of shrinking donor funding, programming has to be done differently. Gone are the days that CSOs would come and say, I'm running a malaria program only. Because we had the luxury to do so. Hire your own CHVs, or now called CHPs, and do your own thing. And so now we are talking about integration. And I think integration is cost effective because it leverages on existing human resource, on the services available in a facility, so that you are not having vertical programming. And so one of the roles of CSOs, number one, I think right now where we stand is that CSOs need to redefine what they call service delivery and how you integrate within primary health care, because we are saying that primary health care is now the vehicle that is going to take us to universal health coverage. And so CSOs, by necessity, have to begin to work, jointly and collaboratively. Thank you. Sorry. Do you want to... Let me pause for a minute. Thank you. I acknowledge the presence of our PS, Oma Oluga, Dr. Oma Oluga, as I continue. And the question is about integration. And so I'm saying that CSOs can help in terms of joint planning and coordination. One of the biggest challenges that we have had, and we admit that as CSOs, is the challenge of coordination. Because you may find that in a county, you could have 20 CSOs, but not all are talking to, actually many don't talk to each other. And they may talk to the CHMT to introduce the program, but they don't talk to each other. And so where we could have leveraged financing, we don't do that. So we end up with vertical programs. So you have CHPs that are paid by the malaria program, CHPs paid by maternal health, CHPs paid by immunization. And so there's a lot of wastage and duplication. So one of the things CSOs can do is to integrate and to change their program design, to entrench integration, to begin to think integration, to begin to work jointly with the CHMT and other players in order to be able to leverage the little money that we have. It is to be able to participate in the annual work planning processes so that you can put in what you are able to do and be able to also leverage what else is available. And so I think for me, the biggest challenge in integration is the program design that many CSOs will have to redesign in the face of tightening fiscal space, need to increase planning and coordination, and also to facilitate multi-sectoral collaboration. What do I mean? I think one of our speakers mentioned, I think it is Honorable Cheboy, that one of the biggest challenges is lack of electricity. Now, a conversation with the people that bring electricity is necessary, because sometimes we look at health as a health sector issue, but we ignore the determinants of health. If we talk about health access, and a woman cannot live where she lives because of security at night, many of the maternal deaths happen because a woman cannot reach a facility. Who is talking to the person who makes the road? And so CSOs can also help to bring about, facilitate conversations that bring in the private sector, bring in other actors, because health is not a health sector issue. Across the board, health is, if you look at agriculture, you talk about nutrition-sensitive agriculture, that is health. If you talk about climate change, health is involved. Look at the proliferation of the diseases like the mosquito-bearing diseases that are now here with us because of the changing climate. So there's a conversation that can be facilitated outside of, not necessarily with health sector, but with other sectors, to ensure that health is seen broadly and not put in health sector alone. So that for me would be one of the ways in which integration can happen. Thank you.
Thank you so much. Is it that because I moved? Okay, allow us to recognize the presence of Dr. Uma Oluga, the Principal Secretary, State Department of Medical Services. Karibu sana, and would like to request you to come up to the podium. Yes, we can do better. Let's put our hands together until he gets here. Karibu sana. Thank you. As you settle in, we are going to have panelist Sarah, who's going to respond to our question, and then we are going to request you to make the keynote address. Sarah, you are a community champion, you are a young mother, you are a young person. So the next question is around immunization, really. As a young person, what is your experience and what does immunization really mean to you?
All protocols observed. I am Omondi Sarah, a young mother of 23 years, a Gen Z, a community champion. To me, immunization simply means taking your child to a near health facility in order to receive the vaccine according to the child's age, which means at birth we normally get the BCG yenye indio alama ya chanjo here.
You're done?
Yes, I'm done.
Okay, thank you so much. From a young mother's perspective is getting vaccine at your nearest point. But also importantly, she's mentioned that she's a young mother of 23 and a young mother was very keen around immunization. So with that, Bona PS Karibu Sana, and would like to invite you to make the keynote address so that we proceed on with the conversation. And the conversation is asking ourselves, how do we secure the future financing immunization for resilient health systems?
Thank you to Excellency Governors, our Member of Parliament, distinguished panelists, ladies and gentlemen. First I want to apologize for being late. Our Cabinet Secretary was supposed to be in other panels, and so I am doubling up with the panels I am supposed to be in and the panels that he is supposed to be in. And I think time is a limited resource, so I do apologize for that. But I believe that the views are unified. When I see Governor Cheboy, and I was with him the other day just in my office discussing some of these issues, then I would want to, even though I didn't hear, but I would want to somehow note that maybe the discussions have been great. From the Ministry of Health perspective, I'll speak from the Ministry of Health perspective. Few things are important for us, and I'll mention 4 of them. One is the whole value of immunization in terms of what we call vaccine preventable diseases. And I think that's where we need to start as a country. Why do we immunize? The why. I think that's the question we have to answer. And I'll give you a practical example of something like rotavirus. So rotavirus is a disease that causes diarrhea in children particularly, and it can be very devastating. If you go to the Netherlands, for the last 15 years, no child has died of diarrhea. So they do not give the rota vaccine because it is not something that is of value to their healthcare system. In Kenya, diarrheal diseases, diarrhea alone is number 3 in terms of mortality for children. So when we look at what we call the disease profile of the country, the disease profile, what makes Kenyans die? So that's where we start. Then we look at, out of these things that make Kenyans die, which ones can we prevent through vaccination? So vaccination is not just something, and I see it all the time, where people are just pushing, oh, we need this vaccine, we need this vaccine, we need this vaccine. It's the disease profile of the country. What makes Kenyans die? How many of those things, diseases that make Kenyans die, can you prevent by diseases? So it starts by part of what we call the larger policy and legislative framework for the healthcare system. Before you finance it, you have to look at what do you want to do? Why are you doing it? The second bit is now the mechanism for doing it. For Kenya, immunization programs have been largely funded by partners, largely. Progressively, the government has been taking initiatives. And of course, you know that because of the rebasing of the country in 2021 to a lower middle-income economy, we are part of those countries that were put on an accelerated program to get out of Gavi support by 2030. Now that means a lot. It means that we have to look at domestic resourcing of our vaccination programs. But it also means that we must figure out the mechanisms for getting these vaccines. So for us, two things are important. One is how do we manufacture the vaccines? Because that is key to resilience that you're talking about. It is key to the resilience. You note that during the COVID-19, we got vaccines when the pandemic was facing out. Mpox, that we have now a few cases, there was a huge outbreak of Mpox in DRC. As you know, DRC relies on Kenya, especially on transport through Rwanda, Uganda. So our truck drivers were the ones that are mostly affected. By the time we were getting the Mpox vaccines, we were already having the cases. So it is very important for us as a country because of what we call the global supply chain bottlenecks that we have experienced. Right now, we are likely to experience a challenge with the Rota vaccine. And so because of that, we are very keen to establish local manufacturing so that we have these things in country. Critical components of health systems like vaccination, oxygen, these kind of things, blood, they are becoming a way in which you cannot rely on another system to be giving you. So vaccines is one of them. And so we are very keen to establish the capability for local vaccine manufacturing. That is why Kenya Biovax Institute was registered as a company under the National Treasury and is under the management of the Ministry of Health. We have now launched a program that we are calling BRIGHT, the Biologics Regional Innovation and Technology Ecosystem, that looks at the value chain for vaccine production from research and development in institutions such as KEMRI, KIPRE, and the universities, how that innovation is made into products and how those products are commercialized into vaccine and then how they are manufactured at scale. So we are looking at that mechanism quite keenly. But the second thing in that mechanism is the distribution, which we usually do. That's where from the factory, the storage that we have in Kitengela, to the regional vaccine centers, to the cold chain at the facility, basically maintaining the quality of the vaccine up to the time that the patient gets it. So that is also key. So before even we get to the finance, I've mentioned first you have to look at what diseases do you want to prevent by vaccination. Number two is what mechanisms are you going to use to get these vaccines. Now number three comes on the financing. How do you finance it? So financing of immunization cannot be delinked from financing of the larger healthcare system. You cannot remove it. And I've said the same about HIV. I've said the same about maternal and reproductive health. I've said the same about cancer. And I've said the same about neonatal health. The moment we split the financing of health disciplines, such as vaccination, family planning, then we are fragmenting the healthcare system. The healthcare system must work as a whole. And its functions are only three. Number one is to protect the health of the people. That means we don't let people get sick. That's where vaccination comes in. Number two is to restore the health of those who are sick. That's where hospitals are. And number three is to promote the health of those who are not sick, so they live longer. That's where things like agriculture, good housing, good water comes in. So the healthcare, the other side, of course, we work with the enablers, but then it's where public health mostly comes in. Education, telling people risk factors, So two of these things, one, protecting the health of the people, and number two, restoring their health, are important in the financing. So when we look at the financing of the healthcare system, and I'm going to talk about now what we are doing, it is also key to look at what do you want to achieve with that financing. And I already mentioned some of them earlier. So for us, as you note, we have done two things. One is that we have made immunization as a strategic issue where finances are ring-fenced. So this year, we had a bit of challenges, and I think just 3 months ago, you guys saw a lot of stories about shortages of vaccines. Now you guys are not talking about that, and you're not also talking that we have restored the issues, Yeah, which is typical Kenyan behavior, that you don't recognize good things. So we have, in 3 months, at least restored normalcy on some of those issues. But now moving forward, we have agreed with the National Treasury on strategic components of the healthcare system that must be ring-fenced, and vaccination is one of them. So this year we have a budget of around 4.6 billion, out of which 2 billion has been ring-fenced for, it can't be moved. It's specific for vaccination. But also one of the other things that we are doing is to ensure that we increase the resources for vaccination. In this, we are discussing what are the vaccine preventable diseases that we can cover under the benefits package. This is still a discussion with the panel that has been appointed. That's the second thing. But the third, which is also quite key, is technology transfer for either fill and finish or drug production that we are also looking at, so that we get some of these components at a reduced cost, and then we finish the production here. It's an important component of financing, because we are trying to engage on technologies or patents that we can either get at cost, because that is what makes some vaccines expensive. And so we, through the World Bank, have also engaged on on a mechanism where we are going to initiate technology transfers. There are already discussions on some components or some antigens, what we call vaccine antigens, that as a country, and I think India did this earlier, as a country we can get the technology to be transferred to the country so that then we reduce the cost. The last bit is vaccine delivery, that is at the service delivery system. And I know that's where we were talking about whether hospitals have solars, whether they have infrastructure, whether we have nurses to provide these vaccines, whether we can have mechanisms to mobilize community through community health promoters. And there we want to work very well with the county governments. That space also is where the partners are supposed to help us. But then we have to coordinate that space. And so we are establishing a health policy platform that then brings to the fore some of the policy innovations, the policy actions that then can be scaled so that the counties or the regions that have had either perennial low coverage for immunization, we can look at what are the models that works that can deliver vaccines to the last mile. And that's also an important component of both financing and resilience. And I think for now, that's where we will leave it. We have a lot of discussions to do. We have a lot of reviews and reforms to do in this space. We are investing a lot in terms of vaccination as the Ministry of Health. And we want to work with everyone so that we bring on board not just the innovations, but we bring on board all the resources so that we have visibility of the resources. Now, this health policy platform helps us do three things. One is what we've been talking about. One plan, one budget, one M&E. So that everyone can talk to each other. If HENNET has money, AMREF has money, everyone is doing something around vaccination. We want to know how much money do you have? What are you doing? Is there impact? Can we bring all these resources together? Can we align the action so that we achieve one goal? Number two is it helps us with policy inclusion. We've had, in the vaccination space, we also know that there have been a number of challenges that relate to immunization, resistance, what we call anti-vaxxers. And so we want to unify voices. When we unify voices, it becomes important. Reasons why sometimes voices are not unified is because of lack of policy inclusion. And so we want to create a platform where everyone feels that they have a seat at the table, not just when you're a big boy like HENNET or AMREF or CHAI or whoever, that every single Kenyan, irrespective of your idea, has a voice at the table. But that voice must be, number one, evidence-based. Number two, must be aligned with the government agenda. Number three, must be practical. Number four, must be sustainable. So that then we minimize what we call noise. There's a lot of noise that is not very useful. If you start taking people, telling them how will this idea implementable, the discussion stops. And the third thing about the health policy platform, which is going to help us very much, is to optimize the healthcare system. Now, optimization of the healthcare system is based on resources, resource deployment. Now, we've had a big challenge with the reduction of funding this year. I think you've seen USG funding withdrawal. You've seen global fund issues. You've seen FCDO has deprioritized health. You've seen a number of countries that were supporting us are deprioritizing health. Now, everyone is talking about what is the government doing to cover the gap. So we, as a government, are also taking a bird's eye view and looking at, instead of just doing something about where the funding is being withdrawn, we want to do something about the entire healthcare system. Now, the entire healthcare system, as you know, is being overhauled. 4 pieces of legislation have already come: the Social Health Insurance Act, the Primary Health Care Act, the Facility Financing Act, and also the Digitization Act. Now, these are just part of the reforms, but we need to look at it from a bird's eye view so that then we solve the puzzle. Sometimes you get efficiency gains not within the same program. For example, you get efficiency gains in the HIV program, sometimes by doing something that is outside of the HIV program. You may get efficiency gains in the immunization by doing something outside of immunization. And so we are taking that bird's eye view so that we optimize all our resources. And I've mentioned part of this is a social health authority where we are increasing domestic resources, encouraging Kenyans to register with the Social Health Insurance Fund and contribute to it. I think those are my thoughts for now. Thank you.
Thank you so much. And for sure, let me start by appreciating the Ministry of Health and the leadership, especially in handling the vaccine stockouts this year, and especially also honoring the Gavico financing. We really appreciate where work has been done. Kudos, that was really great. Because for sure, as Sarah is seated here, she was part of the people who made us ask, so where are the vaccines? And we are really happy that you're also talking about the ring fencing, because at times it's very important to look at immunization at that point. Also the policy inclusion, because once we all speak together in the same direction, we move further, and we really appreciate the reforms that are there. So moving us to the next conversation around health financing. Picking on them, for us to move this conversation, for sure the finances are required. And I would like to ask Honorable Koskei, how can Parliament strengthen, already Parliament is doing, but how can Parliament strengthen oversight and safeguard gains that have been made in vaccine coverage, but also looking at the current tight fiscal space and immunization financing?
Thank you. First of all, and welcome, Principal Secretary. Earlier on, while we opened this conversation, it is notable that the process of financing has been, as we said in the beginning, largely depended on the support, thankfully, by the Gavi. But I think what has been an issue on our part is that even the portion which was supposed to be paid by Kenyan government was either delayed or it took much time, and therefore it hampered the effectiveness of financial flow. And now we are faced with this deadline. In Parliament, we would be able to support the Department of Health if this particular budgetary concern and need can be generated so that it becomes, first of all, as part of the national fiscal planning. So I think as a country, this is something that we cannot rely on. We should have less of others, but more of us participating, because these are our children. These are our heritage. This is our future. And as I said, it is a concern that must concern everyone, that it is about self-preservation as a people. I can see in your banner, you're mentioning the future. We are addressing our future. So I think the challenge would go back to the ministry who generates that need in budget, and I think from us, the legislators, we would be able to support. All right, I also want to join our governor that it will be also, we have capacity on our individual basis in terms of what we call our own private sector contributing to that. Is something that can be explored. I saw in your paper issue about innovation. We can innovate around, and I think Kenyans are very generous, and with the spirit of Arambe, our companies in this country, the industrialists and people with money can be able to support. But I think it must be through the exchequer because it is a national concern. That's number one. We must pay using our own levies and we can say our taxes. We should really put it and feel proud. One of the things that sustains a nation is the national pride. That this is one of the things, and make sure that we fund this particular department. And the other one, we explore the private sector. I think we can do much.
Thank you for those responses. Looking at innovation, private sector, and now moving to you, Your Excellency, Governor. Kindly highlight any innovations in financing for health, but also with an interest of immunization in your county.
Thank you. Like I said before, this is a devolved function, a wholly devolved function. It behoves upon counties to be a bit innovative in raising its own resources so that part of it can be used for immunization. While we know that it is a universal health care issue, but since the implementation is at the county level, it behoves on county government to try to promote own source revenues so that you can be able to meet this expense. Like I told you, in Baringo County, we expect to spend about 110 million shillings. And if we could tweak the own source revenue, then that would be possible. But tweaking own source revenue depends on the local economy. Most of the rural economies are not well developed. And if we can be able to continuously improve the local economies, then we can increase own source revenue, and that can also be used to support this kind of thing. There is one problem, though, that we have. Sometimes we have unpredictable and delayed disbursements of equitable share from the national government, which often affects service delivery. The experience of the last year tells you that there is a challenge, and we are appealing to the national government to release these funds in a timely manner. Immunization does not wait. If a child is born, you will need to do certain immunization within the first 6 weeks or during that period. So as we release the funds that are meant for counties, particularly for health, let us do it in time so that we can be able to arrest the challenges of immunization early. The bigger challenge, of course, is there are competing priorities for resources that come to the counties from both on-source revenue and shareable revenue. When there is drought, for example, you will have to try to secure the interests of the people that are lacking food. It becomes an emergency. You'll have to secure the challenges dealing with insecurity and so on and so forth. So these are the things that we must address. We do therefore ask that we as Kenya must recognize that vaccination is a global issue. It is also a security issue. It affects national well-being. It affects the economy, and it affects security. My brother here is a victim of polio. And if he tells you, you will note that he went to school late because of the fact that he had polio. And, parents will not try to see children that are affected by ailments such as polio and others as a priority. They would like to sort out the ones who are not affected by challenges of immunization. So this is an economic issue. Fortunately, my brother Koske is a very resilient person. that in spite of the fact that he had challenges when he was young, he was able to go to school and do whatever was necessary for him to succeed. But if you look at other children who are affected by polio, the economic status of such children and the way they contribute to the economy is limited. That's why I'm saying it is a national security issue. If you want to get economically stable country, we must sort this one out. So we must look at it as a priority. I also think that there is need to look at advocacy to have vaccination as a national security concern. And I've just said the same, and give it priority. When we are giving money for the Department of Defense or internal security, or, I mean, if there, let me say this, when there were riots and demonstrations during the Gen Z period, everything was mobilized to contain it. Why don't we mobilize resources to contain issues of immunization because it affects the national economy? As much as we are looking at those emergency things that look like they are critical when we have challenges, let us look at vaccination as a national security issue. The PS has said that we need to do ring fencing. I can't applaud that one more than anything else. Let us ring fence these funds so that we can treat vaccination as a priority issue. Thank you.
Thank you so much, Your Excellency, and welcome to the panel, Dr. Valeria from the Department of Health Financing. We truly appreciate that you're with us in the panel as we discuss session around health financing. And colleagues, allow us just one more round of questions, and then we are going to open up to have an engagement with the plenary. So now, next, I would like to move to Dr. Sunday. There's been a lot of conversation in this panel today around innovativeness in financing, but also integration. How do you see the integration between, for immunization to be anchored within the primary healthcare framework? Is that practical or is that a mirage?
Thank you very much. Vaccination is one of the most cost-effective primary healthcare service. And that means that it must be embedded in our primary healthcare, which is now an act. How can this be done? Number one is use of the community. The communities who are the CHPs, the level 1, have to get sensitized on vaccines, knowledge and capacity built, so that when they visit households, they give the correct information. This helps to debunk what we call myths and misconceptions. From then they map out those who are not vaccinated and they refer them to the primary healthcare facilities, which are now level 2s. Level 2s, which are dispensary, all of them, and this is for Kisumu County, are all equipped to give primary healthcare, including vaccination. There is no primary dispensary level 2 in Kisumu that is not giving vaccination as a service. So we have to capacity build all of them. We have 158 public facilities in Kisumu, all of them giving vaccination. And added to the private, we have 25. My competent EPI logistician is here, Florence, and I want to recognize us. He's somewhere sitting there. Good. So if I speak, know that I'm speaking the gospel truth. So using the capacity building of the primary healthcare, level 2, the power has been one of the main challenges that these primary health facilities have. Moving forward, we have to see that those facilities are solar powered. Number 2, the division of NVIP, led by Dr. Jalango, has helped us to get fridges that maintain the cold chain that even if power goes off, they can stay for 72 hours without power. But that cannot be enough, because you know that there are some rural areas in Kenya that still don't or lack power. So as county government, and we have Honorable the governor here, must look into it that his facilities, all of them, as a source of power to maintain the cold chain. Number 3 is capacity building of human resource. All nurses, because at level 2 and level 3, the main cadre are nurses. All nurses from training. And before we deploy them, because we employ, they must go training for vaccination. And this I applaud the NVIP, National Vaccine and Immunization Program, that every time they bring sea activity, they have to have training from the national to the counties, to the sub-counties, and to the community. That capacity building is vital, because therefore we have less vaccine damages, less AEFI. So vaccination is not something we are talking that should be embedded in primary health care. It is, because in level 3s, where now we have competent MCH services, that is one of the main services in maternal child health services. So it is a primary health care. But on to the financing, allow me digress from your question, because I wanted to dissect that when the PS was here, that it is good to use what we call the already existing financing model which we have, the social health insurance. And the social health insurance, and the finance department is here, uses 2 models. It uses what we call the tax-based model and the social insurance model. But when you come to reimbursement, it denies the tax-based component and goes to social health insurance model. So in paper, we know that our SHA is having 2 tax-based, where our honorable appropriate fund for the primary health care. But when we come to reimbursement of facility where we work, it is based on the service you give. That denies what we call the tax base, because for you to get that primary health care, you are told that you must get registered. Tax-based model, so long as you are a citizen, you get the service. As we speak, there are reasons why some have not been registered. I cannot talk about that. But the truth is, we are around 50%, 24 million. Meaning 24 million people have not got registered. If we go to embed it fully on the model that we are using, then these people will miss the vaccination. It must, therefore, that the SHA use the tax-based model. That means that so long as a child comes to the facility, regardless of them being registered or not, you get the vaccine. If we are supposed to incorporate the social health insurance as our main financing for immunization. Thank you.
Thank you so much. Very important conversation. Dr. Valeria, we might need to respond to that, but much later. Allow me to move to Dr. Margaret Lubale. Key conversations from the Parliament, from the counties, His Excellency has mentioned, from also Dr. Sunday, and coming to civil society and looking at the avenues within the public finance management. Then how can community-led advocacy influence budget decisions, but also improve immunization coverage, especially for underserved areas? And allow me to request you in 1 minute to respond on that.
Thank you. So I think the first thing, when you talk about the role of community, it is very important for communities to participate in what is going on, even in terms of the budget tracking. There's need for capacity building so that you are able to have community-led awareness and community-based budget tracking. You need to have public participation that is happening with communities, because at the end of the day, it is the community you're serving. So it is important to know whether what you're serving meets the needs of the community. And so there's a lot of need for capacity building around understanding what the needs are of the people and people being able to generate that evidence and to track the budget against its spending and have dialogue around what is important for the community. Because I think that is something, when we talk about community-led processes, it is not tokenism. It is the community saying what it needs and how it needs it. The other thing is that in terms of being able to debunk the myths and misconceptions that Doc has talked about, it's very important for the community to be the one to participate in debunking. Because somebody mentioned that, the Gates Foundation, people will say, oh, it has fertility in it, anti-fertility. It's important for the community champions to be the ones to debunk the myths so that it doesn't look like it's coming from outside, but they can also participate in being able to create demand and also remove the barriers that build vaccine hesitancy so that people can appropriate the services that are necessary for their children. Thank you.
Thank you so much, Dr. Margaret. So the last two questions, Sarah, you have the mic, and I'd like to ask you the next questions. From a community point, what would you like to see changed in how health service delivery is implemented? This is the moment to bring in what is it from the community's voice that we feel that if this was included, then would have improved health outcomes and also improved access.
In that part of changes, I have three categories. One, the national government, second, the county, and third, to HENNET. To the national government, you should also give immunization a priority, the same way you have given other services a priority. Since immunization is the root of many preventable diseases. So you should set aside a budget that saves money or funding to the county government so that whenever a county have experience vaccine stockouts, is not countrywide. Like whenever my county, Kisumu County, experience vaccine stockouts, I should go to the PS or I should go to Dr. Sunday so that I can address the issue with Sunday in order to prevent those, so that I can go to Dr. Sunday and discuss the issue and tell Dr. Sunday that a facility so-and-so, there's a vaccine that is not being given to the children, not that it affects the whole country. When it affects the whole country, it comes a threat than when it affects a county. To the county governments, you should give more training to our CHPs so that since the CHPs are the one that links us to the county government, more training should be given to them so that they can give sensitization to the people at the county level. To HENNET, you should advocate for increment in the budget allocation on immunization. And secondly, you should give more sensitization to people at local level by empowering champions like me, so that whenever I talk to people at my community, they see the need of their children being vaccinated, especially to us young mothers, since whenever a young mother gets pregnant, there are some mental issues that is normally on their mind. So they start imagining that whenever I give birth, maybe my child may become blah, 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 so that when they are empowered with the importance of vaccination, they see the need for their for them to take their children to vaccination. Thank you.
Thank you so much, Sarah. Now, moving to the last, and this is it the last or near last? And maybe the ones who say and last and that last. So to Dr. Valeria, around sustainability, especially looking at donor transition. We have the Gavi transition pegged at the year 2029. What are the processes and plans and preparedness that the country is having in terms of ensuring that we don't have gaps, but also the transition is smooth?
Thank you very much. I think what I would have to say about the transition journey is, first of all, we are trying to look at where are these resources and who is financing what from the national government, county government, and who are all these players in that space of commitments. Then towards that, we are also trying to see how best to, how can I put it? How best to transition, especially looking at the building blocks. Are the human resource ready? Do we have a platform of how to coordinate the HPTs? And I think the PS was very clear here that one of the ways is how can we leverage on local manufacturing moving forward? And then the terms of logistics, how best do we do it? And how do we coordinate that space? So key to that, of course, around transition, we really need to be clear on who's coordinating and who is stewarding that. The last aspect is mostly around readiness. We may be ready to transition to where we're transitioning to is not ready. So are we all ready to say we've put the resources there, we have human resource, we have the HPTs where they're supposed to be? So that readiness score has to come out very clearly as we plan the transition. And then, of course, the sustainability plans. Sustainability, basically, we're trying to say mostly the resources, and most of the time we say it has to be exchequer, and I think we're all aligned to that fact that whatever we have to do, immunization is an investment. So let governments lead the way. Then two is how best do we progressively include vaccination in our benefit package. Remember, in this space, the purchasers are many. We have the national government, we have county governments, we have partners, we have private insurance, we have the social health insurance. So then how do we strategically do the purchasing? And I think that is where my fellow panelists here was alluding to. Should it be tax funded or should it be social? But the big picture should be, let's have governments lead the way and progressively reduce the contributions, because it's still the same households, communities who have paid tax, and then here we're telling them contribute for your health. So that balance, for now we have started as a mixed model, but moving forward we should move towards tax-funded model for financing. Thank you.
Thank you so much, and what a good point. Okay, what a good point to conclude the conversation from here and open to the plenary. Oh, wow. So I have stood so that we pass the mic, and this is what I'd like to request in terms of guidance. You can ask a question, you can make a suggestion, you can make a proposal, you can seek clarification. So we're also looking for solutions from the room. So we've seen Bwana Nyakwana, thank you. Then we are going to go to the back and then come to Kamau and Madam. That is the first round.
Thank you, organizers of this event. I am Philip Nyakwana. So Nyakwana is the chair of the non-state actors in health. And I have a combination of comments and questions. So my first question, and I wish the PS was still around, because I wanted to ask some questions that are directed to him, but I believe he will get them. My first question is that in his speech, it was both assuring and also intimidating. Yes. And it's intimidating in the sense when you get information, I'm a representative of communities, from communities, and you call it noise. Then next time they will not make that noise. And that noise helps us in responding to the shortage of vaccines. So I think we need to at least find a better way too. He had a lot of plans. We have planned this, we are planning to do this, we have this and that. So my direct question to him is, have they also put aside resources to implement the good plan that they are saying they have? Because that's where we usually have problems. We plan, we have good strategy, good policy, but now we want to look for resources from somewhere else. So I think that one we need to have that in place. My question that when I walked in, Margaret was talking about it, and a song that we have been singing here about integration. My question is, do you have a national framework for integration? Or everybody is integrating their own way? Yeah, because, and what are we integrating? Are we integrating services? Are we integrating human resource? Are we integrating buildings? What are we integrating? Or are we integrating resource mobilization? So it needs to be somewhere captured. Even if we don't have a policy now, we should have some key pointers, 10 or so, that what we call integration should entail A, B, C, D, or should look like X, Y, Z. Then we'll be integrating. My other question is around SHA. We have talked about SHA, and we give it a very good picture. Yes, which it is. But we also know that health is devolved. Do we have the coordination structures of SHA at the county level? Because we cannot say we are implementing, and if it has also the social aspect of it, who addresses the social aspect? Will my mother in the village move to head office in Nairobi if they have issues that they need to be addressed as far as SHA is concerned? My last comment goes to Valerie, and I know we have struggled with this, and I need her to be supported. If we are moving towards issues around sustainability, we must have a conversation on how do we carry everybody on board. And we must map out the role of civil society, the role of the government in all aspects. Because listening to people talk here, they end up at CHP. CHP is the lowest cadre of the government. Where are other community players in this? Because we will not achieve. We have champions. And CHP, by the way, it was the CHVs that was turned to CHP. The government took the name, changed it, without going back to get the concept behind it. So I can tell you it is wrongly being implemented. And if you want to realize that, stop, evaluate, and then learn your lessons on how it's being implemented, and then you'll be informed on the next step to move. So my last comment, please, we need to ask ourselves this question. In all this we are doing, are we spending or are we investing? Thank you.
Maybe I'll start with my last comment. So thank you. Are you getting me? Thank you so much. My name is Evans Kibet, a resident of Baringo County, and I'm really proud to have our governor and our senator sitting in the panel. I am the national convener for the Kenya Devolution CSO's working group. And this morning, I think I mobilized our members to come and, because we take health as a priority in our advocacy. So I have 3 issues to bring to your attention very quickly. Number 1 is, I think it was mentioned by the PS, and also Daktari has talked about cold chain equipment. I think for ASAL especially, or other or mapped as marginalized counties, the biggest impediment in realization of the promise, leaving no one behind in a vaccination, is lack of power, source of power. Given that devolved governments are not assigned the function of electrification of facilities or public facilities, it has become a huge challenge. When we do community scorecard, we see health facility management committees struggle. And this would be my recommendation. We need an intergovernmental approach. And something that is very important. As we do the budgets in the MTEF period, we need to see a specific budget line for electrification of all health facilities in Kenya, with a focus on the primary healthcare facilities. If you look at data will tell you where facilities are not electrified. It's clear. The vaccination inequality in Kenya is very glaring. Secondly, the issue of tracking. We are not measuring. We need to disaggregate the tracking level of, sub-counties and if possible even wards. Because when we generally that this is the immunization coverage of a county, there's a risk of, overlooking the inequalities that exist. So that we make informed decisions, we need to have deliberate, in reporting, including indicating to the sub-county and even to the ward level. So just a question to the team. How are we prepared to, engage at intergovernmental level to ensure that the issues of, supply chain and also the issue of electrification of health facilities is addressed? Otherwise, I really appreciate this conversation. I wish we had more time. I had more questions, but I'll leave it at that. Thank you.
Maybe we can take hers, and then we answer that round. And the second round, we'll have the two gentlemen. Thank you so much.
Thank you, our panelists. My name is Nancy Okwengu from WHO. My specific role is infodemics management, whereby we track and manage.
I'd like to request if we can take that round. And I'd like to request around, there's the question around electrification. And I think that would go to maybe Dr. Sunday from the county perspective, looking at conversations around the national framework for integration. Dr. Valeria, I'm looking at you, share coordination, and also looking at what is the government doing, especially in strengthening policy space to manage the misinformation and anti-vaxxers. We can have the county speaking around the electrification conversation also, Your Excellency Governor, and also the cold chain, especially for marginalized communities. And across the table, we can have the conversation around how do we improve tracking, accountability, and mapping of stakeholders. Because there's a question that Philip raised, that the stakeholders are beyond the community health work promoter at the community level. How do we expand to other community actors? So not in any way, maybe you can start with the governor who's next to me, then we move to Dr. Sunday, Dr. Valeria, and we can open up to the rest of the panelists.
Maybe, thank you very much. I'd like to address the issue of electrification and even the policy on disinformation. I think, first of all, we need, as actors in this space of immunization, to petition the national government through the Health Committee of Parliament to develop a multi-sectoral approach in dealing with the challenges of immunization. Because if we did that, then we'll have the engagement of those organizations that deal with electrification. The Kenya Power and Lighting, the Ministry of Energy generally, we can be able to use available sources of energy, including the simplest and the most affordable, which is solarization of facilities. It should come out as a policy from the Ministry of Health through the Health Committee of Parliament so that they can be able to solicit for the voting of resources for a multi-sectoral approach to dealing with the challenges in the grassroots of implementation of the vaccination process. Even the issue of disinformation, it should also be a policy at the national government level that we need to address that disinformation, whether it is through the Ministry of Information or whether it is through the national security agencies, so that you can manage the spaces that these people use to disinform. I'm not saying that there is a right of information, but the right of information does not include disinforming Kenyans to the extent that people do not agree to go for vaccinations. So I will ask my colleague here to see if at some point you can move a motion with the support of the civil society and the people in the space of immunization to urge the Committee of Parliament to address itself to the issues of immunization and the challenges that it comes with it, in collaboration with the Ministry of Health. We could come in to intervene as county governments. Thank you.
Thank you. I think I cannot really say more than that because multi-sectoral approach would mean, I think, bringing everybody on board who, in one way or another, will have to add value to the public. I think to disabuse this misinformation that comes across, and which, if we do not handle it well, we cannot succeed in any immunization program in our country. For example, last week, I think, is it last week, we saw Bill Gates announcing a vaccine that slows down population. The reaction, and it was in the social media. Such ones will have a bearing in the immunization program. So it is upon the, if we have a multi-sectoral approach, then we are able to provide information to the public with clarity. And when people understand it, they will always appreciate. You remember a month ago or so, there was an announcement from the executive that we need to vaccinate all our cows. And some information going around is that it was going to convert animals into an unnatural presence. And it was really very serious. The farmers reacted negatively, and it was just a simple message. So I think that approach, as His Excellency has elaborated, I think that is an approach, and I'm sure the Ministry of Health with the county health department, you can generate a need, if there is need for a legislation or a national policy that guides the multi-sectoral group so that they can address on this particular, I'm sure I would be very happy, along with my colleagues in Parliament, to enact any act that will improve. I want to appreciate the great knowledge and wealth of information from the county government of Kisumu on how they are practically involved the community, natural social connection of the people. And I think that is very important, that we move together with the people, and not only formally, but also informally as we engage the grassroots. Thank you.
Thank you very much. On power issues, it is important to note that when a facility is being built, power is factored in. If you are in an area where there is no electricity, then you factor in solar. The most sustainable power supply is through solar. Kisumu, we took our team to Muranga to benchmark on solarization, and they're at 75%, all facilities. There's facilities that run purely on solar. So solar is expensive for the time you are doing what we call the installation, but in the long run, it is cheaper and easy to maintain because you will save a lot of money to save for maintenance. You realize that the cost of power currently is very expensive, and we are battling disconnection in many facilities on the ground. So the most effective way is that the county prioritize solarization. It mustn't come from the county coffers. There is what we call aid to trade. Aid to trade is where you get in partnership with people, organizations who can support you. In the process, they also gain. Either they sell solar to other people in your county, or you give them a platform where they can also have their trade. Currently, there is no partner who does not want to trade with you as the government. The next one is integration. Let me take this opportunity to cleave and dissect what integration is. Integration, there are models of integration. There is no single model of integration which is number one or superior to the other. The integration model are based on this health system building blocks. You realize that there are 6 main health system building blocks: health service delivery, human resource, infrastructure, leadership and governance, health information, health records and information. Each of those building blocks are integrated on their own. As a director, I sit at the apex of integration for the county government of Kisumu, especially for the HIV services. We have to bring them back to the normal system so that they are not running in a separate clinic. People going there is an HIV, but there is no single integration model which is approved. Each facility is unique on its own. Bigger facilities cannot integrate those building block at one. Smaller facilities, especially dispensary and health centers, level 3s, can integrate fully from human resource to service delivery. Big facilities like Kenyatta, you can't put them to be in casualty. Jaramogi, they see 400 a day. Can you put people with HIV 400 waiting at the casualty? It's not possible. It's not practically possible. Then an accident comes. It's not practically possible. So they are different. So in those areas we look, do we integrate the service delivery? Do we integrate the pharmacy, the health product? Do we integrate the lab so that we don't have different labs model? So the integration we are talking about in vaccination is full integration because it is a service for primary health care. The only challenge we are having is the financing model that fit the primary health care vaccine service provision. Thank you.
Yes, I think he's just put it very well, that there is no one single model for integration. But for this discussion in this panel or in this side event is we target full integration. But remember, as is well put it, there are building blocks. We need to identify what needs to be integrated. Not everything can be integrated. And that framework, we have to provide or develop that framework to guide the sector on how best to integrate, especially thinking of the planning, optimization, efficiency, cost effectiveness, then all these have to work towards how best to integrate. So thank you.
I think I wanted to just echo what Nyakwana has said. And to say that, you know, it's a fallacy to imagine that when you spend on health, when you put money in health, you're spending, not investing. And I think that is a paradigm shift that needs to happen, because many times, even when we have the budget read out, the first sector that will have cuts is health. And the last time we had the issue of co-financing nationally, money was removed from the budget, and we had to lobby to get the money back to be able to pay the co-financing. And so one of the things we need to answer practically is whether really health is a spending or an investment. Number two, PHC is people-centered. But when we talk about PHC, I find that when we talk about level 1, we talk about CHP allowances. And that is not level 1 service delivery, really. They are a vehicle. But is that the only thing that happens in level 1? And so that is another paradigm shift. Primary healthcare happens across the board. Because if I go to a doctor in level 4 and I have, say, high blood pressure, he will give me tips on how to improve my lifestyle, my diet, and all that. That's primary. It's prevention. So he's giving me medication, but also giving me prevention. If we can nail what level 1 services are, and as Doc said, get the financing, not SHA, because SHA reimburses. How will I reimburse community surveillance? How do I reimburse sensitization around the budget? How do I reimburse sensitization of mothers for FP? How do I reimburse? Do I count the number of heads? Divide by what? So I think there is a discussion that needs to be had to be able to put the right financing on level 1, so that you don't just say that level 1 is CHPs. I like what Nyakwana has said. As CSOs, we have worked with, they were called CHWs. When we began HIV, 2003, 2004, they were moved to CHV. Now they are CHPs. Is it the same monkey, different forest? Or different monkey, same forest? Is a question we need to ask. There are lessons we have learned, and that is one of the contributions that CSOs can bring on the table around how to maximize the use of that HRH, that human resource. We know we have lessons that we have learned over the 30, 40 years on how to maximize the potential of the CHPs. And I could go on, and Faith is looking at me, so I will stop there. But my question is, how do we continue to entrench PHC, make it more people-centered, bring the voice, visibility of the people into PHC? A paradigm shift is needed, and I think dialogue needs to continue around what really is PHC and what is PHC at level 1. Thank you.
Thank you so much. One is a comment and one is a question. First, I'd like to comment that when you're thinking about immunization, male are often forgotten. And I think, especially for new vaccination, male are usually very critical decision makers. So how do we get to think about it? And when you're thinking about sustainability, think not only in terms of how to finance it, but across the 7 SDGs, how do we connect them? Then my question is, how do we ensure commercial viability while still focusing on equity? And this is particularly looking at immunization from the context of making each facility, one, being able to cost each service that we provide. For instance, each person, each child costs 10 shillings. Then how does the government focus on making that service payable for that child so that in level 1, level 2, level 3, and level 4, where the services are expected to be provided for free, such service is costed, and we know that this number of services were provided and this value was given.
Faith, as Joshua takes the mic, their comment.
Hello? Huh? Hi, you, sir, and the governor, and everybody, thank you. James Kamau from Kenya Treatment Access Movement, a member of HENNET, and a member of CREED, Coalition for Health Research and Development, which is where vaccines fall. Now, we have tried very, very hard to try and put the vaccine budget. It never works. I will ask my friend, the good governor, how much he has put in the services. But I can also suggest something which he can do. He has a Beyond Zero van, not one, I think 2. His advantage, and he knows why. Can those are the kind of services getting the vaccine to the people? Because those things had cold storage. You understand? So in terms, and that doesn't cost much, taking the service to the people. What requires now is for them to be told. But then coming to vaccines, in the transition framework of which I was a member, there was the vaccine, there were 5 items that were there, and there was vaccines and to take over. As we all know, there's the transition. Gavi is going. Gavi gave you, as Kenya, warning 3 years ago, and we took it for granted. And we started running about the other day. So my question is, I'm hearing, how can the registration make sure that this thing goes through? Secondly, we need to emphasize on the fact that we will not achieve UHC without proper vaccinations, of which the people are doing. And also, it is not that people are ignorant. Going to the village, those people know what the value is. I think that is where we need to, and then the registration. The highest plundering of funds, corruption, was in the is it called the MedVax laboratory, which has not been working. So those are the kind of things that we need to do to bring it down.
Thank you very much. My name is Anne Michura. I am Dr. Anne Michura, a director with the Nuclear Power Agency, which is under the Ministry of Energy. And I've had a lot of issues around electrification and particularly into the rural areas. I'll not talk much now, but I would like to say that's our main challenge. The PS also put to the fact that we need to do either refill and finish or do drug production. And we know all that is under a production, industrialization, and we need enough power to be able to run that particular sector, even with other sectors. So then there is a plan in the national government under the agency where I am, where we are looking into installing a nuclear power plant by the year 2027 to add 1,000 megawatts to the grid by the year 2032. And this being a cheap cost of power, it is going to enable even the current hydro, solar, and geothermal power to be able to be subsidized by the nuclear power to go down. So once the cost of electricity is low, then we are now able to do the manufacturing at an affordable cost. You might find that importing might sometimes be cheaper than manufacturing if the cost of power and other issues are up. So we are in that process, and I know in the intersectorial whatever, we will be able to contribute. And whatever you have said, I will pass to my colleagues and also to the energy. Thank you.
Thank you so much. Allow me, Thank you. We had quite a number of contributions and also some questions. So I'd like to request in the panel if we can, not in any order, respond to the questions that have been asked. And after that, I want to request enough a minute each of us make our closing remark in line with, are we on the right track in securing that future? So I think we'll start with Dr. Bag. You respond and make your final remarks.
Yes, I think my final remarks would be is, yes, we are in the right path, especially noting that we are trying to ring-fence resources for immunization. So the call really is, how is the national government and the county government collaborating in making sure we sustain the efforts that have been done so far with the support from the partners, and also how best to include communities, especially as we do this policy making and decisions moving forward. Thank you.
Thank you so much.
Thank you. Just to respond, before I make my final remarks, is that vaccine, we have to take it up as a country, as a priority. Because we know that the reduction in childhood mortalities, especially the under 5, that was 78, and now we are at around 42 per live birth. Per 1,000 live birth, is because of the use and integration of the vaccines in our routine immunization. It is an evidence-based, cost-effective model that makes us improve on children's livelihood, not only for them to survive, but for children to thrive. Long ago, my grandmother told me that they used to give birth to a lot of children so that some of them die on the way, so that you, at long last you have some children who survive. We cannot continue in that age. We want us to have what we call a responsible family that is economically empowered, and that the service that they get is of good quality. So that can only be done if the life of a child, whom I am advocate, get improved. We have the resources. It is only the priority. All other sectors in government get appropriation of funds from the parliament. Why not vaccination? In the Luo community where I come, if someone comes to help you build a house, it is the owner of that house to start digging, and the rest of the community join. When it is a mud house, when you start putting the mud, it is the owner of that house who has to put the mud first before the congregation starts. If it is roofing, you have to put something on the bedroom. That is when you own that house. If you leave the partners to run with all the service, we cannot say it is our service. It is theirs. We only own it when it starts from us. Partners are supposed to support us. They are not supposed to be given the full responsibility of what we are supposed to have. As a citizen, we give taxes to the government to get good education, quality health service, which is our right, and our honorable member said. So that means that we have the power, we have the resources to make this be appropriated, and then the counties give the service as the national get into policies and regulation of the quality of the vaccine that we have. Just allow me say this experience. As a director, I got a response from our DG, Director General, Dr. Amoth, on what we call AEFI, Adverse Event Following Immunization. So we report, and then he reports to me. I get a letter, dear Dr. Gola, on EFI. These cases, these elaborating on each and giving me the probable reason why we could have those side effects. That is the responsibility level that the county government and the national government has when it comes to service delivery. But for financing, our honorable member advocate for us for allocation for primary health care, which is fully integrated the vaccination process. It is possible, and thank you so much.
Thank you, Dr. Sarah.
One thing that we should put back in our minds is that immunization is both important to us as a parent, you as a parent, and to us, the whole country. So for us to do away with this thing that these preventable diseases, ignorance should be put aside in order to save the future of our young children.
Thank you.
Yeah, first and foremost, I want to say on behalf of HENNET that I am very grateful that you've been here, and as the ED of HENNET, thank you very much, and looking forward to opportunities of partnering with all of you individually and collectively. Finally, I want to say that, you know, UHC has a deadline of 2030, SDGs by 2030. I don't know how our scorecard is going to look like, but one of the things that I can say as a CSO network is that CSOs and communities must be in the ecosystem to be able to co-create and to be able to help us to come up with a paradigm shift to accelerate results as we hurtle towards 2030 so that our results can improve as a country. So thank you very much.
Okay, thank you so much. I think I wish to encourage participants of this particular forum today that a constitutional right, you don't have to beg for it. And it is not possible that it becomes impossible to achieve such a product that will serve the citizens of this country. I only want to encourage you from a legislator's point of view that the caucuses, which brings together the civil societies, community health providers, those in county government who are really having this particular huge responsibility, if you can petition Parliament on a very structured way, and I'm glad Mr. James, you are talking about we have tried, it is not working. Let me tell you how you can get it easy. First, it is a constitutional right. I think Article 43 of our Constitution, that health is a right to every citizen, including our children. So what you need to do is that I can see in some areas of this country we have a robust civil society, community organizations. What you need to do is move beyond sensitization, move beyond awareness, move beyond empowering the citizen into concretizing your concerns and findings into a petition to Parliament. When you send that to Parliament, then you caucus around a few members of Parliament who can caucus in the House. And I want to promise you I will be one of them to help you. So just concretize, bring a petition, and when it reaches the floor of the House, it will be given to the department, Departmental Committee on Health, as His Excellency has put it. Otherwise, let's keep the conversation going on, and don't shy, and don't be a victim, especially at county government level. Voice it out. If it is not working, can you tell us what we can do? And I think as Parliament, we will respond to the request by the people.
Thank you very much. I think this session has been good. Let me say this. As a governor, I will take up this matter, even with the Council of Governors, for us to prioritize the issue of primary health care, and in particular, the issue of vaccinations. But more important, and I want to take the line of my colleague here, that I think the HENNET and the civil society organizations that deal with health should also perhaps see a way of sensitizing legislators at the county level. More often than not, we politicians, and I'm guilty of it, tend to go for structural things. We would like to see a hospital being built. We would like to see school being built. But the softer issues, such as vaccination, they are relegated to the periphery. So as you go and do petition at the National Assembly, similarly do the same at the county assemblies. And when you petition at the National Assembly, the key thing here is for Treasury, during the budgeting level, to ring-fence budgets for vaccination and primary health care. And of course, the budget is supposed to be a public participatory issue. So I don't understand, I don't know how much we, the stakeholders in these issues of immunization, have raised our voices during the budget-making process. But the key matter is legislation to create an act of parliament that compels Treasury to set aside a certain percentage of funds towards immunization and primary health care. And when it comes down to the county governments, the same should happen. Thank you very much, and God bless us all. Thank you.
Okay, thank you so much. Colleagues, let's put our hands together again for His Excellency Governor Chakoi, the governor of the great county of Baringo. Oh, please help me with that. Let's put our hands together for Honorable Jackson Kosgei, a nominated Member of Parliament, Let's put our hands together for Dr. Margaret Lubale, Executive Director of the Health NGOs Network. Let's put our hands together for Sarah Atieno, a community champion, a young mother. Let's put our hands together for Dr. Ogola, the Director of Medical Services, Kisumu County. And let's put our hands together for Dr. Valeria, the head of health financing at the Ministry of Health. And let us put together for us. I appreciate your patience. I appreciate that you've been here all this while. We started thinking that we'll be here for just 1 hour, but I really, truly appreciate, and I know I did not introduce myself. So this is the point I introduce myself. I'm yours truly, Faith Ndongo, Advocacy Manager at the Health NGOs Network, and it is always a pleasure when we have conversations, because the conversations give us solutions, and like the panel has stated clearly, there's no point that you go wrong when you're doing the right thing. So, Tana, let's keep the fire burning. We want our young babies to be the next happy leaders tomorrow, and the power is in our hands in the decisions we make today. So with that, thank you so much. When I'm going to be requesting, I've also been reminded, and I'm sorry to the online team. We understand we had an online audience. Asanteni sana for being with us this long. And we truly appreciate that in this Devolution conference, we are not only having conversations, but the health and the well-being of our children are part and parcel. We are securing that future, and we appreciate the commitments. I believe as citizens, we have a role to play. We've been told, do we really participate in public participation? So let us come out in the numbers, and I truly appreciate, let me invite Alan. Alan has indicated that today many people are used to people bringing gifts are female. Do we say that this is the gender conversation evolving? So I'd like to invite Alan, David, and Joshua, who are going to present gifts to the panel here. Appreciate the Principal Secretary, Dr. Oluga, in his absence. We appreciate for the inputs that he's given. So to Alan and team.
Okay, thank you so much. Let's appreciate our panelists one more time. And also appreciate yourself for coming. We've been here for more than 2 hours. Not really an easy task, but we really appreciate you. So, honorable panelists, we have gifts for you. And we are requesting that you just receive it, and then we shall do the full packaging to your team. So this is for Honorable His Excellency Benjamin Chesire Cheboy, EGH, EBS. Thank you for your esteemed participation as a panelist at the DevCon Conference 2025. ED, our ED, Dr. Margaret, I would request that you hand over this one to, you hand over to your fellow Daktari. Nipea Margaret. Nipea. Okay, thank you so much. I think I request Dr. Valeria to, oh, they don't leave, okay, so. Request Dr. Valeria to pick one for Dr. Ogoluma. Dr. Margaret, you can sit. Just wanted you to have the honor of honoring Bishop. Okay. I request RISPA, please come on board. Let's appreciate RISPA. She's the regional coordinator for the global health advocacy. Please hand it over to Dr. Margaret Lubale. Unamujua. Sunday Gola. Tusonge hapa chini for a group photo. Awasimame kwanza. Sawa. Okay. We have a few CECs, some county officials. After this, you can join us on the podium just for the group photo, please. We also honor you. Okay. We'll hold the... Faith, you are requested for the group photo, please. So we request the county officials and VIP team please join so that we can have a group photo. We really honor you. We come to the counties and you are the people. I'm happy to see the PHC lead Kisumu. Wewe ni mrefu. So any county official present, you are welcome, please. So watu wa kamera tunaomba mtupange. Tuko sawa? Okay. Okay, so the final we are having is CSOs. HENNET is a membership organization, so our members and any CSOs present, please. Governor, just 1 minute. Any CSOs, Mato, please come. Mburu, Nyakwana, I can see Ngumi. Please join us. Yeah, one photo and we are. Dr. Sandy. Songa, tafadhali, we save on time. Dr. Sandy, Faith, please, let's tupige a picture and then we stop. Fine, please. Oh, Harrison, you are CSO. Harrison Logistics CSO. Wewe, watu warefu kama Kilioptara mnasimama mbele, si nyuma. Baada hajapiga So, thank you. Allow